Good evening, Stuttgart military community. My name is Colonel Jason Condrey, your Garrison commander, and I'm joined tonight by Dr. Troy Baker, and we want to give you an update on COVID. So I want to begin tonight by offering many thanks to an incredible team of Garrison professionals that have been working incredibly long hours and frankly are willing to place themselves between this community and the virus. So whether we're talking about our hotels, our CDCs, mailrooms, medical staff, maintenance staff, all of them have proven to be incredibly dedicated and committed to this community. And the amount of gratitude needed. I also want to say the same thing for our partners and employees that are keeping food service, exchange facilities, and our commissaries open. So I'm thankful. I know our community members are thankful. This is a stressful time, and I'd ask that you thank them and perhaps offer a smile. So I want to give you a short update before I ask Doc Baker to give you an idea of what's going on with respect to the virus. So in the last 96 hours, we have gone from 2 cases to 12 within our community, doubling within the last 24 hours. Virus doesn't discriminate. It's hit military, civilians, contractors, spouses, and today, our first kid. You know, you've heard me talk about transitioning from a jog to a sprint. The reality is we've been behind, and in my opinion, are still behind. I can't fix that. I need your assistance in fixing that. Schools were canceled, and this Thursday, virtual instruction begins. Teachers have worked incredibly hard and are ready to do that. Units across the footprint implemented Mission Essential or some sort of alternative work plan. And a lot of those people that aren't working are doing new jobs in order to protect the community from this virus. Something we can't see, something that is already inside the wire affecting this installation. We've made some progress as it relates to personal hygiene, hand washing, social distancing. But urgency and the self-enforcement is not where it needs to be. We have lots of members in our community that are in quarantine and isolation, and each day that number goes up. With each phone call that the Trace team makes, that number goes up. So in yesterday's video, I mentioned shelter in place. That term is scrolling across news screens. It's at the top of news feeds. And perhaps not a surprise, but there's no established definition of shelter in place from the CDC or any other official source as it relates to this pandemic. So tonight, I'm going to attempt to define what those words mean for our community. And so before I get into that, Dr. Baker, please give us a quick update.
All right, thanks, sir. So here's kind of the update. Right now in Germany, there are 10,000 cases. For reference, on Sunday, there were about 4,500. So we're continuing our doubling about every 3 days, right? We've been doing that for almost about the past 2 weeks. So it's a pretty steady state here in Germany. We're still doubling every 3 days. As Colonel Condrey said, we have 12 active cases in our community. Overall, they're doing great. They're doing well. I've called almost all of them. They all answer the phone. They're all at home doing what they should be doing, staying in isolation. So they're not out there walking the community, doing things they shouldn't be doing. So, and they're all doing really, really well. When I ask, are you doing fine? They're like, yep, I'm doing great. I feel a lot better. Fever broke yesterday. That's pretty much the common response whenever I ask them. One of the questions they get asked a lot is, what is our clinical operations situation at the clinic right now? We're broken down into 3 groups, or 3 different operations. One is the COVID screening, also known as the drive-through. And with that, people will hit a checkpoint, and then we'll guide them either into the line or over into what we call the respiratory care parking lot. And our goal is to have people with respiratory issues not show up in the clinic right now. We don't want coughing kids, we don't want coughing adults in the waiting room coughing on people at this time. Hopefully that'll change at some point in the future, but right now we want you guys outside in your car waiting for us and then we'll come grab you and bring you in. Then we have the respiratory clinic, and the goal of that is to identify people that probably aren't COVID. It's hard to really make that determination, but we try our best. So someone, for example, like a sinusitis, or a child with a otitis or an ear infection, or someone with their, I've had this cough for 2 months thing. And so, but those are still respiratory. We don't want those guys in the waiting room. So we'll still try to identify those people, and then we'll escort them back around the clinic. And then we have the non-respiratory clinic, and that's pretty much everything else. People there for their medications, people there for non-respiratory issues, get their baby checked up, things like that. And you can come into the clinic, and we'll screen you at the front door, make sure you're not respiratory, and then bring you into the general waiting room. Another question that comes up a lot is, how do we make the COVID diagnosis? There's a couple ways to do it. We're doing a lot of the labs. We do a lot of labs, probably more labs. I don't know anyone who's done more labs than we have, frankly. I've asked around and at different places, and we're testing, and we're testing a lot, which may be one of the reasons that our numbers are higher than others. But I believe in test and trace. We found some pretty good links within the community when we're doing the trace, and then we can actively and aggressively go after those. But one thing is our lab supplies are low. At some point, we will run out of swabs. Germany will run out of swabs. Big Army will run out of swabs. And then at that point, it comes down to a clinical diagnosis. If you've got the right symptoms and you have a good link, and maybe the link will just be Germany, and we don't have any other explanation, we would consider you a presumed positive COVID and go down that pathway. So one of the other questions we also get is, who should come in and get in the drive-through screening line, and who should just stay home? And this really comes down to, who are we going to test? And the people that we're going to test are the people who have a close contact with a COVID case and they're having symptoms, or people with significant symptoms. So think somebody with a really bad flu, so fever, a bad headache, body aches, headache, and then a really strong link. And at this point, we're defining a strong link as somebody with travel. So either you've traveled recently to see other folks, or a lot of people have traveled to see you. Also, anybody who's been in large groups, like international conferences, other things, and then people with a large community exposure. So some of us are, we just go about life and don't have a huge exposure to the community, but others do. Nurses in the healthcare clinic have a lot of community exposure. People who work at the gas station have a lot of exposure. Anybody who's always out and about and has more exposure than someone else, we'd consider that a strong link. The people that don't get tested are the ones who have an exposure but no symptoms. So even if ground zero with a known COVID patient, if you're doing great, we're not going to test you at that point. You're just in the quarantine status. We'll wait and see where you go, and if you end up getting positive, then we'll try and test you if we have the supplies at that point. And the other people, and these are the ones that are tough to figure out, they're the ones with mild symptoms and a general community exposure, which kind of defines what a lot of COVID is. But we're still not testing those guys at this point because we do have limited testing supplies, and we want to save those for the ones with the really strong links for that.
Okay, another question I got that I think lands in your basket. So there are people that are walking around wearing masks, and some of them I know are immunocompromised, and so they still need to go out and do things in the community. Hopefully not as often because they're trying to protect themselves. But should people be concerned if they see somebody with a mask within our community?
In general, probably no more than anyone else. People with a mask on, we want those. If someone's having symptoms, if you're having a cough or a runny nose or any other upper respiratory tract infection, we want you to wear a mask just so you don't cough on someone. You could be COVID positive. In terms of whether you should be afraid of someone in that mask, probably less so because they got the mask on. It's the person that you don't know who's coughing on you without the mask, or the asymptomatic shedder, and they're out there. And that's the reason we have all these things in place. That's the reason we're pretty much locked down. We got the shelter in place, kind of moving forward on that. The reason why we have so many people, why we shut down all the bazaar and all the sports teams and all that.
Okay, thanks. So you led into the next point. So shelter in place. Just ask Google, and you can find lots of definitions of what that means. And generally, they all converge on finding a safe location and staying there until given all clear. So, for our community, what does shelter in place mean? What does it mean for us with respect to this virus here in Germany? And so, shelter in place describes all of the public health protection measures that individuals, leaders, and organizations are requested to implement in order to isolate and prevent the spread of this virus and allow the installation to be the shelter for the community. 78% of our community lives off the installation. And with the uncertainty in the coming days and weeks, we must ensure that this installation is that shelter. And so there are 4 pieces to that. Protect. That's active isolation of any cases within our community. Social distancing by all members of the community outside your home. So isolation within your home, when you are outside of your home, social distancing. That's how we prevent further spread of this virus. That's how we end what's inside our community. The mission. We've got to enable our partners, the organizations and units across this footprint, to continue to do what they are here to do, whether it's on the installation or away from the installation. And then sustain. And from my perspective and my role, that's the essential services and activities that have to remain open to the community on the installation and those that are off that may depend upon us. Some of those service, it's not going to be an open door that you walk through. It's going to be on demand. We want to know when you're coming so that we can put in measures to protect the staff and to protect you. I want there to be confidence on both sides of the table. And then finally, integrated. We have to be integrated with our partners and our communities outside of the installation. Again, 78% of our community lives there. So if we are markedly different in how we are approaching this virus, what we are doing, then we've created the potential for a problem. And the reality is the conditions may change. They may implement additional measures that we don't. We need to be prepared for those. We're going to try and keep you informed as those conditions change. So again, you'll see increased efforts in the coming days, starting tomorrow, in order to ensure that this garrison is the shelter that it needs to be for our community. So, critical services and functions, you've heard me say that. That's our PXs, our commissaries, our food courts, the gas station, the mail rooms, the post offices, all of those things that you rely on day in and day out. All of the things that serve food, the DFACs, the canteens, the clinic, those are critical things that we must maintain. I know that child care facilities, they're important to you, but at some point, if the staff is sick, I'm not able to put a credentialed worker back in place, then that service may have to shut down as well. And that'll have impacts on organizations across the installation. We need to protect against that happening. And that's not just the staff's responsibility. That's a parent making a hard call because you know your child and know when they're not right. You have to protect your child against the other potential problems in there, but also protect those child care providers. So we talk about how things are changing, and I'll be honest with you, it's tough even for me to keep track of them, and the information is supposed to flow through me. So I'll get a phone call and find out that the one person that provides one service has now been directed to self-isolate. And so that service isn't available until I can find somebody else that can do that job, create the credentialing, give access to a system. So what we have done as a garrison to help you understand, because I don't want you to get, leave your home, get in the car, and come to a service only to find out that you needed to have made an appointment in advance, or that the service is closed. And so those of you that aren't using your smartphones right now, pull them out, open up the U.S. Army Garrison Stuttgart app, You downloaded it from the iPhone store or Google Play. In the middle, there's a button that looks like the COVID-19 virus. That button is where we have put all of the links to the videos, the messages, the resources, all the things that you have seen on Facebook. I don't want you to have to search for those. They're in one place now. That will also be the location that you can go and find out if there has been an unexpected cancellation or a loss of a service. Or if you want to go do something with housing, how do you do that now? Do you go there, click on the link that says housing, and you will find out how you do things with the housing office. It may be as simple as, hey, call this number and make an appointment. Now, I realize that there will be unique things that are unique to you, problems that constitute an emergency within your household, within your family. I want to know about those. So at that same link, at that button, there's an email address at the top. That email address sends your issue to all of the people across the Garrison that are the fixers of problems. And it goes to me, it goes to the Garrison leadership. And we will solve your problem. I don't want you relying on a Facebook message that goes to the PAO. I don't want you relying on a phone that wasn't forwarded properly. I don't want you relying on an ICE comment. We have created something specific to this problem that if you need assistance, if you need a VAT form because there's a surgery scheduled, use that. We will answer you. So there's increased health protection measures. And so these are the things I'm requesting of you. Very few of you work for me, so I'm not directing you to do this. But the reality is, if we want this Garrison to be the shelter, then here are the things that I need you to do. Individuals, you've heard me say this before, you are still our first and best line of defense. Self-assess every morning. The things that the doctor laid out. If you are not asking yourself that question, how do I feel? And I assure you, if you've come in the gate the last week, you know what the questions are. You know what the symptoms are. Self-assess when you get up in the morning. If you don't feel good, don't come to work. Self-assess before you get up and go to the food court, before you go to the commissary, before you go to the post office. There will be other people there that would appreciate that. Be honest with yourself. If there is even a question in your mind, don't go to those places. Stay at home. Hygiene. Wash your hands. Implement social distancing. Enforce it on yourself and those around you. I've requested a battalion worth of nuns with one yardsticks. I can't put them out there to ensure you stay 3 feet away from each other. You have to do that yourselves. Cleaning teams. Develop cleaning teams in your workspaces. Develop cleaning teams in your stairwell apartments. Utilize them often, especially if there is somebody in your stairwell apartment that is now self-isolating or quarantining. And if they are, there will be people coming in to support them. It may not be the neighbors. It's probably the unit or the organization they work for. They may be carrying the virus. You've got to do that. That's on you. There's not somebody from the housing office that's going to come and do that for you. Be nice. Don't get frustrated with our screeners. Don't ask them medical questions. They're not medical professionals. There are people that have come out of their day jobs to help us protect us from ourselves. They're placing themselves between the community and this virus all day, every day. Their primary job is to ensure everyone is educated. So no trickiness with the questions that they're asking. Be straight, be upfront, don't be a problem for them. Quarantine. If you are directed to self-quarantine or isolate, the only person that releases you or your family from that is a doctor. You got to stay home. I'm going to ask you to put a sign on your door that says in English and German that you are self-quarantined or isolated. I want to make sure that our fire and emergency responders, many of them will likely be Germans if there's a fire, understand that they have to put on the right protective equipment if they need to come in to your dwelling. That piece of paper will also have your phone number in case someone needs to get in touch with you. It'll have the phone number and the organization which is supporting you. And it should also have how many days you're going to be quarantined, when it started, and when the doctor said it should end. The doctor still determines when it will end, not the piece of paper on the outside of your door. You owe that to the people that are coming to help you. You owe that to the people that you live with. So I spent a lot of time talking about what you can't do, what you shouldn't do. There are some things that you should do. Get out and be in the sun. The sun and warmth are the mortal enemies of this virus. You don't have to worry about social distancing within your family. You guys are trading doorknobs, sitting close to each other. If one of you has it, you've all been exposed. So get out as a family. Stay off my playgrounds. No more stairwell barbecues. Go out for walks. Go ride a bike. Go for a run. And I'm sure there's some ingenious people out there that will find a way to do group fitness training in some of our big fields while still maintaining social distancing. I'm looking forward to seeing that. I just asked, no sweaty high fives at the end. Air elbow bumps. Leaders, you're the next line of defense after individuals. I need you to look at the members of your team each and every day. Ask them about their self-assessment. If you get any hesitation, make a leader decision. Implement social distancing in your workplace. Figure out who needs to be there, who doesn't, how you can stagger, how you can create redundancies. We've had lots of organizations where with one phone call, that entire section is out of action. We've got to figure out how to protect from that. Organizations. First of all, I want to thank partners across the installation that have given up people, changed their day jobs to put in the measures that help us make this installation our shelter. So across the footprint, these organizations will be implementing a second layer of defense. You've seen it at the gates, but we already know that it's inside the wire. So that second layer of defense will be at the single entrances and exits of all of our critical services across the installation. And so in front of each one of those, there's going to be somebody that's asking you the same questions that you were asked if you drove onto the installation that day. Again, be nice. Smile. If somebody is being asked a question in front of you, give them their space. You're next. Implement support plans for an increasingly growing population of people that are isolated and quarantined. They may need assistance. They may not want to ask for assistance. Be persistent. Figure out how we can make sure someone doesn't have to make a hard choice and come out of isolation and quarantine. Check on them daily. If you don't get an answer that you like, call a doc. We will find somebody that gets that answer. Okay, so those are the things that I am requesting that you do. And I'm requesting that leaders across the footprint enforce those with direct lines of authority. This is the only way that we're going to beat this virus. Did you get some questions?
I did, sir. So we have a couple of questions here. One is from Matt, and his question is, what is considered acute care? So acute care are things like fever, cough, abdominal pain, or some things can be acute care if, for example, routine care is interrupted. For example, you run out of medications and you really need your medications. Go ahead and do that. If you sprain your ankle, think you might have something broken, come on in. We'll get you screened, make sure you're not respiratory, and then we can get an x-ray on you and then either refer to ortho or just put you in a splint. Things that are not acute care are like routine exams. If you're here for like a school exam or a general sports physical or whatnot, hold off on that if you can. Certain other administrative exams that are just basically paperwork things that we do, hold off on that. And then like knee and back, a chronic knee and back pain, neck pain, again, wait on that as well. Let's see what else came through.
I got one before you go to the next one. So this was some of the questions I have, obviously not focused on the medical piece. So, are German postal trucks allowed on post? Short answer is yes. I haven't found a reason not to let them on, and the reality is what they're delivering may be critical to somebody that has ordered that item. And so I'm hesitant to stop things like that. I'm also going to let German garbage trucks on and the delivery men, because each one of those trucks brings something that our community needs. We're going to put the measures in place and make sure that we are protecting ourselves, especially if there is interaction with people. So what I will tell you is implement measures to make sure that if you're maintaining social distancing, you'll be fine. There should be no issues with somebody bringing something on. Have them leave the delivery at the door.
Jess asked, how quick are the screening results? Right now they're pretty dang fast. About 24 hours is really what we're getting out of Landstuhl. We're sending all of ours up to Landstuhl. So send them out yesterday. They're usually back here by this afternoon or in the evening. May switch to 48 to 72 depending on weekends and then as time goes on, but right now it's pretty quick. For those who want to know, every single person that has had a positive has been identified or been notified rather. And so if you haven't been notified, then right now you're still negative, and we're getting our nurses and all of our calling staff to try and give you a call, and those are coming in. But everyone who's positive has been notified. I've talked to everyone who's been positive in the past 48 hours.
Okay, I have a question here. Why is the Kelly Car Wash closing if it does not require staff? So I can't clean the things that you touch at the Kelly Car Wash after the last person uses it. Also true for every doorknob you touch, but I also can't close all the doors. So this is one area where I can implement a prudent measure. And the reality is, your car will be okay if it doesn't get washed in the next couple weeks, maybe even months.
Morgan asked, if we have an elective doctor or dental appointment, should we go, postpone? The guidance right now is to not go, postpone these. Right now, I believe Landstuhl is shutting down their elective surgery. And a lot of this is and I think a lot of the places downtown are doing that as well. And part of the reason they're doing that is they're shifting towards more ICU care. And so they're changing. What they don't want to do is they don't want to have an OR or a recovery room full of patients when it all hits. And then what are you going to do with them, as well as the influx of potentially, lots and lots of people that overflow their capacities. So right now Germany's, it's been doubling a lot, and we'll kind of see if it goes the way of Italy. We won't know for another week or two, where between 3 and 9 days, I think we'll have a really good idea where we stand. But until then, they're leaning forward, and so they're getting their ventilators online. They're bringing in the critical care people they need. They're realigning their inpatient and their outpatient stuff so that they are ready to handle a possible influx of patients rather than get caught flat-footed. So if it's routine, try and postpone it for now.
This next question is, could there be special shopping hours at the commissary for high-risk people? The short answer is yes. What I would ask, though, is that if you are high risk, find somebody else to go to the commissary for you. I don't want you to take that risk. If there's a problem and there is no other way, let me know. We will make special arrangements to ensure that you are either supported or have an ability to access the commissary.
Here's another question. Can prescriptions be refilled at the clinic? Yes. If you are a non-respiratory patient, if you just need a refill of your blood pressure medication or your thyroid medication, call it in and come on in and pick it up. We'll screen you at the front, make sure you're not respiratory, and then bring it on back. if you are a respiratory patient, if you're having cough or any of the other symptoms that we expect with this, you can still get it refilled. Call, let us know, we'll get it refilled for you. And then let us know when you're going to be arriving via telehealth. And we'll have, or just go to the front and say, and at the front desk, we'll catch you, say, I'm here for medication refill. And then we'll have you go back out to your parking, and tell them where your car is. And then we'll have you go back out to your car and wait, and we'll have one of our runners get your medications for you and bring them out to you.
Is the bank mission critical? Short answer is I don't know. And the bank may be one of those services that once the tellers and the people that have access to the safes, if they get sick, the bank's not open. I'm hesitant to cut off something like a bank and tell them to close their doors because I don't have an understanding of the impacts on the community as a whole. And so I'm inclined to do as much as I can to keep services like the bank open as much as possible. Another one?
Yep. Tricia asked, can you get influenza A or B and COVID-19? The answer to that is yes, but right now it's considered unlikely. It all comes down to prevalence of the disease in the community. We've tested about 85 thus far, and of those 85, we've had, I believe, 7 come back positive. And then there's a few others in the community that were tested positive from the Germans and whatnot. So even and half of those 7 were from a pretty tight cluster. So even under quarantine precautions, but if your flu's negative and you look really sick and fever and we can't explain it, and we haven't got the testing done, then we'd call you like a presumptive positive or just clinically diagnosed and treat you as a COVID-19 patient.
So here's a question. Are food service workers going to be offered any extra protection while with customers? So I would say the most important element of protection is establishing that 6 feet of separation. So the counter does half the fight. If you as a customer are standing back away from the counter, then you have created that additional space that equals the social distancing necessary to protect you. Shouldn't be any high fives, shouldn't be any shaking of hands as you receive your food. But right now, there's not anything that a food service worker needs to have in terms of personal protective equipment in order to do their job as long as people maintain social distancing. If that changes, guys like this will let me know and we'll implement those measures.
Here's another question. Will the main gates begin checking temperatures? Probably not. It's problematic to do that, getting the right equipment, and creates a lot of false positives and false negatives. And even with our equipment that we're using at the clinic, we were like in the drive-through, some of that stuff wasn't quite working the way we expected just because it was really cold. And so it just doesn't work to bring that type of stuff out into the cold environment or very hot environment, and then expect to get an accurate thing and then make a decision based on what that shows. So as of this time right now, we're probably not going to implement temperature changing unless some other tech comes up.
I've got a question here about the mailroom. So how long can we access mail, and what will be done if the mailroom closes? So postal workers are another one of those uniquely qualified workforces that if they get sick or are unable to come to work for any reason, if you bring COVID into the mailroom, and I now have to close that mailroom because every one of those workers has been exposed to COVID, then I don't know how long that mailroom will be closed. It may be closed as long as 2 weeks, the time it takes people to come out of self-quarantine. So that's why I'm focused on protecting our mailrooms. There may be a way to relocate postal staff from one installation to another. We will look to degrade capabilities across the installation before we close one specific mailroom. But the reality is our postal workers, they're a limited workforce. And the moment they're gone, we're waiting until they're healthy again before we start doing mail operations.
So Shell asks, what about infant immunizations? So yes, come in and get your infant vaccinations at the clinic. We're trying to screen all the respiratory out, so nobody, without any respiratory in the clinic should not be at risk. So bring your baby in and get the vaccinations done.
So the question is, any chance you will close the food court? So we have one dining facility on the installation here on Panzer Barracks. There are not many options for food, which is why you still see the food trucks. You still see every food court open, the Subway out on Kelly. Those things, in my opinion, are important for us to continue to feed the people that live on the installation and work on the installation. And as long as they don't provide a public health risk, we will keep them open. I'm not sure how we will feed the community if we close all of them, or if we have a problem and can't keep the commissaries open. So is there a chance they will close? If I lose the staff, if they are unable to go to work, then we'll have to close them. But as long as they're implementing proper hygiene, proper social distancing, and you as the customers are implementing proper hygiene, proper social distancing, I think we can protect them and keep them open. Already taken out all the chairs, all the tables, all the things that cause people to hang out in there. It's takeout only. Come get food. Don't hang out next to somebody while you're waiting for food, and continue to move.
Yeah, I'm a little bummed they killed the salad bar, but there's still the sandwiches. So Michelle asked, what HP con level are we at? We're still at Bravo. I don't think we're allowed to change it here. I think that comes from a higher level from us. So we're still at health protection level Bravo.
Rich asks, can we get an outdoor gym like Vincenza? There's lots of things I wish we had that were like Vincenza. The weather, a big area outside of a new fitness center, one that you could close the gate and keep equipment that's stored outside and undercover from walking away. But because I can't protect our equipment from the weather or mayhem of any other flavor, I don't know how we're going to be able to make outdoor gyms. Looking for opportunities. I know units have the ability to bring out functional fitness equipment that they've received. So there are ways to do that and maintain social distancing. But again, you've heard me say this before, cardio. You got one? Go ahead.
I don't have it quite yet.
Okay, I'll take the next question. So this question comes from Michael. How do we maintain grooming standards without barbershops? So the barbershops and the beauty shops are what these guys would consider a high-risk contact. High risk for you, high risk for the barber or the beautician. And so I'm reminded of my younger days when a private with a set of clippers solved your haircut problem. Short answer is we're gonna have to figure it out. I don't know yet, but I don't anticipate us opening up the barber shops or the beauty shops anytime soon.
Here's a question. Do you need volunteers? Can we volunteer? So that's a tough question. So, we always need more help, but the problem is always getting the right person at the right place at the right time. For the most part, we're doing pretty good right now, but that could change any moment. If anyone in the clinic were to pop positive for COVID, that would have some pretty big impact on us. I would say the best thing you could do if you're looking to volunteer would be, one, look out for people in your community. So, people will post on Facebook whether they're COVID positive or you may just hear. Help them out. Ask them if you can go shopping for them, maybe cook a dinner for them or whatnot. Most of them would just appreciate just probably shopping for them, although ask them to let you know. The Red Cross is probably a good place to put your name in, because if I'm looking for volunteers, that's one of the first places I'm going to call. I'm going to say, hey, listen, do you have any volunteers that we can use for whatever? And so call them up, get on the list of places to volunteer with them, and they'll be one of the first places I call if we get down to the point where person after person goes down and we need someone to do part of our mission.
I've had a question here from Janae. How can people social distance if required to report for work? So I will tell you, here in this building, we have found ways to work, yet still be within the distance that you're supposed to be to be social distanced. It may be as simple as not having a meeting in person, everybody dialing in for a telephone call or a video telephone conference. There may be other ways. Somebody's in the office for this period of time, they leave and somebody else comes in next, especially if you're in a small office space. There's lots of different ways, and the reality is the ideas don't just come from people like me. They come from people like you that work in the spaces that you are and may, with just a simple conversation, be able to implement some things that have an impact when it comes to stopping the spread of this virus. So the reality is you probably need to come to work if you've been told you need to come to work. And so work with your supervisor, work with your leaders, understand how you can implement some social distancing and still do the things that you need to do. Got one?
Yeah, so Christian asked, how does the virus affect pregnancy? Nobody knows that right now. Some things like influenza, hepatitis, those are a lot worse in pregnancy. Right now, this virus appears to be sparing the young. There's still no deaths really that I've read under the age of 9. But that said, you're pregnant, your immune system is not what it normally is. I would still take extra precautions and really decide whether you want to go out or whether you want to go with that group. We shouldn't be doing that anyways right now, but if you're waffling between one decision or the next, choose a conservative one.
So I've got a question from Aaron. Is it making a difference asking questions at the gate? The short answer is I don't know. But if asking questions at the gate can stop 1 out of 1,000 people from coming onto the installation that's infected with COVID-19, then we're going to continue to ask questions at the gate. As a matter of fact, now that it's inside the installation, we're going to continue to ask questions at every place that our community comes together and has contact with other members of the community, so that no matter what effort you as an individual put into social distancing, those places where others will likely bump into you, we're going to make sure we do additional screening there. Again, if it stops 1 out of 1,000 from spreading this virus, it's worth the effort.
So Catherine asked, if we reach shelter in place, will we still be able to attend off-base medical appointments such as OBGYN care? And the answer to that is yes. If you need to do required medical care, and I consider prenatal care as required, go in. Make sure you call whoever the physician is, and make sure they know that you're coming in, and then if you have any symptoms or not, so they can give you the appropriate directions. But if you need medical care, don't just sit in your house with a broken arm or something else like that. Go get your medical care.
Okay, so the question that just came in is, are we shelter in place? The reality is there's no clean definition for what shelter in place is. We need to be the shelter, and that requires additional effort on our part. If someone defines it and says, you, Stuttgart, need to be shelter in place, and this is what that means, then we will adjust the definition that I've just laid out for you. But right now, it's an all hands on deck effort to ensure that should we need to shelter, that the installation is prepared to be that shelter.
Kelly asks, we were in Alsace, deemed high risk by RKI. What do we do, not do? At this point, Europe is risk. It's transmitting in our communities, it's transmitting in Alsace, it's transmitting in Italy. It's here, and so really nothing to do unless you start having severe symptoms. And I would judge that more on just you're in the Stuttgart area, rather than in Alsace, let's definitely do it. So it's just you're here, and it doesn't really change anything at this point, just because it's so widespread.
I have a question related to travel. So what are the current travel restrictions for military outside of the country? So first of all, if you were somewhere else and you reside here, the guidance is to find a way to get you back here. Now there's lots of different variables in that. Are there planes available? Is commercial transport available? Will you have to wait for some sort of military transport? Those are questions we're asking. Don't have the answers yet. The reality is it depends. It depends on where you are, why you were there, and how quickly we can bring you back. Similar, another travel question related to student travel. Will students displaced due to college be granted entry into Germany with their SOFA stamp? So if they are a dependent of a military family and have a SOFA stamp, they will be able to return. There also may be instances where members of your family can still travel here. So again, that's going to be subject to the same kinds of limitations that we are seeing as it relates to commercial transport. I'm not sure that if they established increased military transports, if under those conditions a student would be able to return back home to be here with parents. As I find out more about that, we'll be sure to share. So another question related to housing. This one's from Janae. Please address maintenance contractor and what is an emergency work order. So for me, it's all about life, health, safety. If you have a light bulb that's out, a light fixture that's not working, I'm not going to ask a maintenance contractor to come in and fix that for you. Now, our maintenance contractor is still focused on fixing everything that's on their list. You may decide that you don't want them to come into your house. I understand that. I've asked our contractor workforce to put in the measures that not only protect their workforce, but convince you that you are protected should they come in to do work. So, life, health, safety. The standards haven't changed. If you've got a question, if you've got a concern, let us know. Will the stairwell be informed if someone is quarantined? So the way the notification works is generally through medical channels and through chains of command. There is not a mechanism in place for the Garrison to notify you that someone is quarantined. Our presumption is that you are tied in closely with your neighbors, and you will notice as you're walking down the stairs if someone has a new sign on their door that they placed there that says quarantined or isolation. So that's the mechanism that we're trying to put in place to help neighbors understand what's happening around them if for some reason there's not good communication or support within a stairwell. So first of all, I want to thank Dr. Baker for his efforts in general in support of the community and for being here tonight and answering the questions that only he could answer. We're gonna, again, the email address for all these problems, these emergencies that from my perspective are one eaches, things that I'm not gonna ever consider until you identify it as a problem for your family. Go to the app, open the COVID button, the link to the group mailbox that hits supervisors and fixers across the installation. It will go to them. We will find which organization or organizations need to be part of that solution. Use the app. That's where we're going to hang the most current closures, cancellations, how to get access to services, and what measures that we're asking you as consumers of those services to take so that we protect the staff and the staff protects you. Those are the things that we're going to do, and that's going to evolve. That's going to be the location that you find out that information. I appreciate that you took the time tonight to ask questions, to listen to what myself and Dr. Baker had to say. This video will be posted, and as you have additional questions, let us know. I'm looking forward to answering them. Thank you. Have a good night. Wash your hands. Social distance. We've got to beat the virus. We've got to ensure that Stuttgart is the shelter. And that starts with you. Thanks. Good night.